Assalamu alaikum and welcome to the 8th match of Cardiometabolic Premier League, the Battle of Brains, presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into the 8th match, that is between MMC Wolves and DHQ Sahiwal Stellars. It is second match of Group C, and from Group A and from Group B, Ames Invincibles and Lum Strikers have made their places in Super 6 stage. Today, we are blessed with the kind presence of Professor Azizur Rahman Saab. He will be serving as a umpire of today's match. He is Professor of Medicine and Senior Vice President of PSIM. Along with him, we have with us Professor Murad Ali Saab. He is Associate Professor of Medicine at MMC and also mentor of MMC Wolves. For moderation purpose, we have with us Assistant Professor of Electrophysiology, Dr. Qurban Hussain Khan Saab. For further moderation, over to Dr. Qurban Hussain Khan Saab.
Well, thank you very much, Usman Saab. Assalamu alaikum to everyone out there. Welcome one and welcome all to this fascinating contest. We are deep within the competition. We're in Group C, which is the third group. One team has already successfully beaten the opposition in this group, and that was last time round. JPMC, they performed magnificently. They scored 10 points out of 10. So well done to them. They're on the fast track. We have an interesting competition today. We will be dealing with two wonderful teams. One is the MMC Wolves, and the second is the Sahiwal DHQ Stellars. The format of the competition will be different today because Sahiwal Stellars are not yet online, so there will be no coin toss, and we will go directly to the questions which I shall ask of the MMC Wolves. But before we do that, I'd like to introduce the MMC Wolves. Can you introduce yourself, the captain, please? Introduce your team members and introduce your mentor and coach as well.
Well,
MMC
thank you,
Wolves.
sir. My name is Dr. Mohammad Zishan. I'm working as a postgraduate trainee, final year postgraduate trainee. To the right of me is Dr. Ehsan, and to the left of mine is Dr. Asim, and last but not the least, Dr. Nasser Hussain.
Wonderful. And who is your coach and who is your mentor?
Our coach is Dr. Murad and Dr. Manzoor as well, and I am the captain myself.
Excellent. And Dr. Murad is online, I understand. Good to have you on board, sir.
Yes, yes.
Well, I'll just run through the rules. Your opposition are not yet on board with us online. There may be a technical issue. We'll have to resolve that. So you will be given the opportunity. You can see the screen. They're not yet there, but the connection is sound. So we'll have to see if we can do anything about that. So MMC Wolves, you are in the driving seat. What will happen is we will ask you the questions. You will have the opportunity to choose between scenario A or scenario B. I will read out the scenario and then I will read out the questions. You will be given 60 seconds to answer each question, and a correct answer will give you 6 points and an incorrect answer will give you 0 points. And your target, as always, is to score 60 points out of 60 to give you a chance of qualifying for the Super 6. So, without further ado, we will progress to the next stage, and I'm hearing that Sahiwal are online. So, what I've just said has been totally thrown out of the window. Sahiwal Stellars, Sahiwal DHQ Stellars, can you hear me?
Yes. Yes.
Excellent, good to have you on board, and just in the nick of time as well. Great. So what I've just said doesn't actually apply. There will be an electronic coin toss as there normally is. Can you please introduce yourself, the team captain, and your team members?
Assalamu alaikum. I'm Dr. Zishan. I'm in PGR Access Medicine. I'm the captain of the team.
Assalamu alaikum. I am Dr. Abbas, PGR Medicine.
Assalamu alaikum. I am Dr. Mubashir, PGR Medicine.
Assalamu alaikum. I am Dr. Waqas, PGR Medicine.
Okay, we can hear you, I think. I think your team captain, can you just say something? I just need to check that we can hear you properly.
Yes, yes, we can hear you properly.
Right. There seems to be an issue with the mic. I think we should fix that.
You have to switch mic from the person sitting next to you.
Yeah, I think you should switch your mic. Maybe you should share with the person sitting next to you.
Okay.
We need the team captain on board. We need to be able to hear what he's saying because he's going to have the final word regarding the answers. Okay, so just to remind you, the format is there will be an electronic coin toss. The winner will get to decide whether they ask questions or whether they answer questions. And the winner of the coin toss will also decide whether scenario A or scenario B will be the first scenario asked. Now, in contrast to what I said earlier on, the team which asked the questions will read out the scenario and then we'll read out each question stem. It's a best of 5 approach. You get 6 points for a correct answer or 6 runs and 0 runs for an incorrect answer. Your target, as always, is to get 60 out of 60. That would put you in contention for the next round. So, just to remind everybody out there that this amazing event is the Cardiometabolic Premier League. It's powered by Wilson's Pharmaceuticals and it is endorsed by the Pakistan Society of Internal Medicine and of course the Pakistan Hypertension League. And let's get this contest underway. So Saiwal, you're on the screen. So let's start with you. You have the opportunity to take the bull by the horns and you will decide on the electronic coin toss. So we'll just hold on a minute. Is Dr. Zishan Farid there?
Yes, yes.
Okay, Dr. Zishan Farid, you are the coach, as I understand. Is that correct?
Yes.
Okay, Dr. Zishan, as the coach, you cannot compete as a competitor. The other team players are registered as competitors, but you are the coach, so I'm afraid you can't be present and you can't assist. So I would humbly ask you to please vacate your seat and let the other competitors. I think there's a wry smile there going on.
Let me clarify. I'm the captain, not the
You're
coach.
the captain. So perhaps there's a misunderstanding on our part. Can we clarify that, technical team?
Hanji.
Technical team.
They're taking me as a coach. Coach है?
नहीं, he wants to participate. He is not coach.
वो अगर कह रहे हैं अगर आप कोच हैं तो सीट वैकेंट
Okay, we need to clarify the situation. The data that I have is that Zishan Farid Saab is the coach. The coach cannot compete.
ठीक है, okay, no problem.
Thank you very much, Zishan Saab. It's up to the rest of you guys. We have to obey the rules, and the rules are clear. So you need to elect.
What is this qualification? If he is also PTR, he just have to rename as long as he is just PTR.
Let's clarify the situation.
Qualified? Is he already?
Dr. Zishan is working as a registrar at the hospital.
What is his qualification? Is he fellow?
Can we answer that question, please? Has Dr. Zishan completed his training?
Yes, he has.
Right. Professor Azizur Rahman, they have another team member, but
has he qualified?
has he completed his FCPS exam?
No.
Okay, bring him back.
Okay, and I think now we got a substitute. I think it is nice to have a full 4-member team. All right, I think now we're full quorum.
Wonderful. Thank you, sir, for your kind help, as always. Let's get the show on the road. Electronic coin toss. Let's get Saival on the screen. Saival, are you ready?
Yes.
All right. The electronic coin toss, you're going to need to pick heads or tails. So, heads or tails, pick.
Head.
Okay, they've picked heads. Go for the toss. And they win. They've won the toss. The game is in your hands, Saival. You are the ones on the front foot. You are taking the initiative. So we have to ask you the question. Do you want to ask questions first, or do you want to answer questions first?
Answer.
Answer the question better.
Mic लगाने पे.
Whoever's speaking should have the mic in their hand. Do you want to ask questions, Saival, or do you want to answer questions? I need a response.
Answer question.
You want to answer questions first. Okay. So they're going to be trying to put a good target on the board. So looking forward to that. Next, let's go to the next section. You won the toss. You're going to decide whether you're going to go for case A or case B, which will be the first case. So pick one. Case A, case B. It's random.
Failure. Case B.
Okay, you've gone for case B. Excellent, excellent, decisive. Okay, now I would like to ask Mardan Medical Complex Wolves, MMC Wolves, please read out the scenario for case B. Team captain, MMC Wolves, let's have them on the screen.
A 65-year-old male with a history of COPD, type 2 diabetes mellitus, and hypertension presents to the emergency department with increasing shortness of breath, confusion, and lethargy for the past 24 hours. He reports a productive cough with greenish sputum and worsening dyspnea over the past 3 days. On examination, his drowsy respiratory rate is 32 per minute, pulse of 115 per minute, and regular. He has a BP of 135 by 85 millimeter of mercury and using accessory muscles of respiration. His oxygen saturation at room air is 82%. His labs are as follows. IBG shows a pH of 7.26, partial pressure of carbon dioxide of 65, and partial pressure of oxygen with 55 millimeter of mercury. His bicarbonate levels are 125 milliequivalent per liter, lactate of 2.1 millimole per liter. His WBC count is 14,000, CRP 80. Chest X-ray shows hyperinflation with increased bronchoscopal markings. No consolidation seen.
Okay, did you get that, Saival? Did you understand that scenario? Did you hear it? Can you see it on the screen?
Yes, yes.
You can see the scenario on the screen and you've heard it. You've heard it clear. Excellent. Let's move to the first question. Question number 1, please. Let's have that on the screen and let's have MMC read it out.
What is the most likely diagnosis in this patient?
Read the options, please.
Options A, acute respiratory distress syndrome. Option B, pulmonary embolism. Option C, acute exacerbation of COPD with hypercapnic respiratory failure. Option D, heart failure exacerbation. And option E is bronchiectasis exacerbation.
Let's start the clock. It's in your hands, Saival. Take your time. Consult with yourselves. Is that your final answer? What did you say? B for brother?
Yes. Yes, final.
Okay, they're being very aggressive. They've made their minds up. Shall I lock the answer?
Yes.
Okay, that's a lock. B, pulmonary embolism. Have they done it?
We have asked C.
Did you ask for C?
No, sir. No, sir. No, sir.
No,
Yes,
yes.
for B, pulmonary embolism.
They first
No.
whispered C.
There's no going back. They asked
C
for
was our
pulmonary
answer.
embolism.
It's crystal clear. It's C.
C. Crystal clear. We are not illiterate.
The umpire will decide. The umpire will decide.
C.
I think it may be in my mind. I heard they whispering C, but let me. Is there any way?
Yes, you are right.
Usman, is there any way of checking the recording?
Sir, but it will take time.
Acha. But you can
Yes.
do it in the background.
Third umpire.
We asked for a review.
I think we need to clarify that. We'll get the umpires involved because they can review the footage and achieve a correct result. I did.
Kumar, meanwhile, maybe we can keep this pending and
Yep.
then we can let them check the results.
Absolutely, sir.
See.
Let's proceed. Let's proceed. So if there's been a mistake on our side, we apologize for that. It will be corrected because we will review the audio and the umpires will accept it. So let's move on to question 2. Can you please read it out, MMC Wolves?
What's the most appropriate initial management step? The options are increase oxygen to 8 liter via face mask. Option B is initiate non-invasive ventilation. Option C is administer IV furosemide. Option D is immediate endotracheal intubation. And option E is start IV theophylline.
The clock has started. Take your time, consult.
B.
So your answer is B, initiate non-invasive ventilation. Non-invasive ventilation. Is that your answer?
Yes.
You're sure? Absolutely sure.
Yes.
Okay, so let's lock that in. Answer B, non-invasive ventilation. Well done. Well done. Congratulations. You've got some runs on the board. The third umpire is reviewing your first question, but you've got the runs on the board. Congratulations. That's 6. You waited. The ball was wide, and you cut the ball in the air over the third leg boundary for 6 runs. So that's brilliant. Okay. Let's move on. Next question, please. MMC Wolves. Question 3.
Question number 3 is, what is the main pathophysiological mechanism in this case? Option A is alveolar hypoventilation. Option B, diffusion impairment. Option C, ventilation perfusion mismatch. Option D is pulmonary shunting. And option E is increased dead space ventilation.
Start with 60, please. 60 seconds. The countdown has begun.
मिसमैच नहीं होता सीओपीडी में हाँ बीच में मिसमैच होता है
मिसमैच तो लेकिन ब्रेन एम्बोलिज्म में एम्बोलिज्म में मिसमैच
वेंटिलेशन
मिसमैच एम्बोलिज्म में अल्वीलर हाइपोवेंटिलेशन के सीओपीडी था ना
अल्वीलर हाइपोवेंटिलेशन सीओपीडी में क्या होता है
सीओपीडी एम्फेसी में तो डेड स्पेस बढ़ती है
डेड स्पेस बढ़ती है
Half your time has elapsed. Take your time.
E.
So I'm hearing E, increased dead space ventilation. Is that your answer? Final answer. Agreed?
Yes.
Okay, let's lock that in. Let's see what you've got. No arguments there, I think. I think it was clear. So alveolar hypoventilation is the correct answer. So you faced an in-swinging Yorker and you thought you could hit it to the offside boundary, but you totally missed and your off stump is flying in the air. You are out. But not out of the game. Not out of the game. You're still in the game. You can still win. Keep your heads up, guys. Question number 4. MMC Wolves.
4 is, which of the following ABG findings confirm type 2 respiratory failure? Option A is pH more than 7.4, partial pressure of carbon dioxide less than 40. Option B is pH less than 7.35, partial pressure of carbon dioxide more than 45, and bicarbonate more than 26. Option C is pH less than 7.35, partial pressure of oxygen less than 60 millimeter of mercury, partial pressure of carbon dioxide less than 40. Option D is pH 7.35 to 7.45 and partial pressure of oxygen more than 80. Option E is pH more than 7.45, partial pressure of carbon dioxide less than 35.
The countdown begins.
दोबारा से लिख लिया एक मिनट टाइम देखिए प्रॉब्लम
ये CO2 रिटेन कर रहा है बी वाले में और बाइकार्ब कंपनसेटरी में ज्यादा हो
ज्यादा हो गया हाँ पीएचपी ड्रॉप कर रही
सी वाले में PCO2 लेस देन 40
यार देखना उसमें जो 2 है ना उसमें तो लेस देन 7.35 है 60 से
थोड़ा
ज्यादा
बी ही एप्रोप्रिएट लगा है
Half your time has elapsed, guys.
बी
बी बी
So that's B, the second option.
यस
B for Bravo, B for brother. Shall we lock that in?
यस
Okay, locked in.
टाइम को कुछ है
Well done, well done, brilliant, brilliant. You didn't let the last setback pull you down. You waited for the full toss and you smashed it back over the bowler's head, over the long on boundary for 6 runs and into the crowd. Great, great play. So you've put some runs on the board. You've got 2 sixes, 1 duck, and 1 to be determined. So you're there. You're in the game. You're playing well. Great, great teamwork. Let's move on to question 5.
Question number 5 is, which factor suggests an indication for endotracheal intubation instead of NIV in this context? Options are, option A is respiratory rate more than 25 per minute. Option B is pH 7.3 on ABGs. Option C is oxygen saturation of less than 90% on NIV. Option D is Glasgow Coma scale GCS of less than 8. And option E is hypercapnia with bicarbonate retention.
Countdown begins.
यार मैं हाइपर कैप नहीं है वो फिर
नहीं हाइपोकैप्निया तो NIV भी चल जाएगा मुझे लग रहा है C ऑप्शन है या D है
डी होगा
यार ऑर्डर सेंसोरियम में जाते हैं तो हम इंटुबेट करके वेंटिलेट कर देते हैं इसको C ऑप्शन लेस देन 90 ये भी हो सकता
CO2 लेस देन 90 नहीं लेकिन वो तो फिर हमें पहले तो हम माइक्रो ऑक्सीजन नहीं देंगे
Half the time has elapsed. Take your time, take your time.
क्या लग रहा है
ड्रॉप कर रहा है डी
डी कर
ड्रॉप कर रहा है उसका
मेरे ख्याल डी है ई है
D भाई D कर
डी डी
D, is that Glasgow Coma scale less than 8? D for Delta. That's a lock. Yes, lock. Yes, 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 yes. Now we're cooking. Now we are cooking. So the bowler bowls a short ball and you take a step on the back foot and you pull to the leg side for another 6. So that's brilliant, brilliant play. Now we've reached a point now where we finally have the recording for the first question. And I think that would make a lot of difference. We wish to welcome Professor, our patron-in-chief, Professor 𝐒𝐓𝐄𝐋𝐕𝐄𝐒. Professor 𝐒𝐓𝐄𝐋𝐕𝐄𝐒, are you there, sir?
Charlie, Gabby, we're looking after the side. Okay.
Assalamu alaikum, sir. Professor 𝐒𝐓𝐄𝐋𝐕𝐄𝐒, कैसे हैं, sir? How are you? Okay, let's get back to the contest. We have a replay of the first question. We need to find out whether DHQ Saiwal got the answer correct or not. So let's have a replay. Your hand, Saiwal. Take your time. Consult with yourselves. Is that your final answer? What did you say? B for brother?
Yes. Yes, final.
Okay, they're being very So, unfortunately, I did say, was it B for brother? And the answer was yes.
ये और क्वेश्चन पे आपने कहा है ना ना ये और क्वेश्चन पे था नहीं ये और क्वेश्चन पे था no
It's question 1's replay. It's the replay of question 1.
क्वेश्चन 1 पहले बोले क्वेश्चन 1 का रिप्लाई करें
Let's replay question 1.
Question 1
replayed question.
Read the options, please.
Options A, acute respiratory distress syndrome. Option B, pulmonary embolism. Option C, acute exacerbation of COPD with hypercapnic respiratory failure. Option D, heart failure exacerbation. And option E is bronchiectasis exacerbation.
Let's start the clock. It's in your hands, Saival. Take your time. Consult with yourselves. Is that your final answer? What did you say? B for brother?
Yes. Yes, final.
Okay.
Sorry, यार वो और पे कह रहे हैं.
I'm afraid
Take question 5 in front of us.
I think
they're being very aggressive. They've made their mind.
We are asking it C. We are asking it C.
We are clearly saying C.
We were clearly saying C.
So this actually immediately goes to the next question. Actually, I think we should stop the recording there. The replay should record there. Should not display this picture. This confuses them. I think what I heard is they said actually they didn't say B, and you said B, and they mistakenly agreed with you. I think
Yes, we have said C.
they said C.
Yes, we have also marked C on our pages.
Can we have the recording again?
Embolism. Option C, acute exacerbation of COPD with hypercapnic respiratory failure. Option D, heart failure exacerbation. And option E is bronchiectasis exacerbation.
Let's start the clock. It's in your hands, Saival. Take your time. Consult with yourselves. Is that your final answer? What did you say? B for brother?
Yes. Yes, final.
Okay. They're being very aggressive. They've made their minds up. Shall I lock the answer?
Yes.
Okay, that's a lock. B, pulmonary embolism. Have they done it? Oh. So I think it's clear that they chose C. I think it's clear that they chose C.
We are clearly saying it's C.
We have said C.
When
Yes.
you told us that we are going to log pulmonary embolism B, and we are all saying no, it's C.
Yep,
You can
I agree with that.
clearly-
I agree with that. I think that I think they should be given the benefit of the doubt. There is no doubt. They said C.
They said
So-
C. They said C.
Yes, definitely. We are all saying it's C.
So let's
and
give
they
them the
agree,
points. So that's a 6. Third umpire has spoken. Thank you,
you so
Professor
much.
Azizur Rahman. Thank you very much. They've got 6 added to their score. So can we update the score, please? So wonderful. So now, out of 5 questions, out of a maximum possible score of 30, DHQ, Saival, Stellars have scored 24. So justice has been done. Let's move on to question 6. MMC Wolves.
Yes.
Question number 6 is which one of the following is most likely cause of worsening hypercapnia in this patient? Option A is increased ventilation perfusion mismatch. Option B is increased dead space ventilation. Option C is decreased respiratory drive. And option D is alveolar consolidation. Option E is pulmonary vasoconstriction.
C on it. Respiratory drive is C.
Charlie by Kane साथ.
C for Charlie.
C for Charlie, decreased respiratory drive. Is this the opinion of all of you or just some of you?
All of you.
you.
All of us.
We are
All
all
right.
captain.
Well, you've gone for it. You've been aggressive right off the bat. So let's go for it. Option C, decreased respiratory drive. Let's lock that in. Brilliant. Brilliant. So after that initial setback where injustice was done, you reversed it. You're back in the game and you are scoring very, very freely. You have faced the off spinner and you have smashed him further down the park out of the ground for 6 runs. So a brilliant performance by Saival Stellars. Brilliant. Let's move on to the next question. Question number 7. Read.
Question number 7 is what is the primary goal of NIV in hypercapnic respiratory failure? Options are number A, improve oxygenation. Option B is reduced carbon dioxide retention and work of breathing. Option C is increased lung compliance. Option D is reduced systemic inflammation. And option E is prevent aspiration.
It's B, beta.
B for beta. The second option, reduce CO2 retention and work of breathing. So that's your initial answer. Is that the opinion of all of you?
Yes.
Yes.
I hear yeses all over the shop. So let's lock that answer in without any further ado. Have they done it? Have they done it? Yes, yes, yes. It's like a runaway train to Saiwal or from Saiwal. It's unstoppable. Brilliant momentum by Saiwal. So they are smashing the ball all over the park and they've scored another 6. So their score is up to 36 out of a maximum of 42 points. Just one mistake in their entire sequence. We've got 3 questions left. Can they really crank up the pressure on the MMC Wolves? Next question, please, MMC.
Question number 8 is, the treating physician decides to put him on NIV. Which of the following settings is most appropriate initially? Option A is IPAP of 10 centimeter, EPAP 5 centimeter. Option B is IPAP 8 centimeter and EPAP 2 centimeter. Option C is IPAP of 20 centimeter, EPAP of 10 centimeter. Option D is CPAP 5 centimeter, and option E is EPAP 18 centimeter, and option E is IPAP of 18 centimeter and EPAP of 8 centimeter.
Well, that's quite a lot of letters there, acronyms.
Inspiratory alpha या E alpha 2:1 तो नॉर्मल होते हैं ना, इतनी रहती है जो है ना, EPAP 5 होती है और IPAP 10 होती है, लेकिन रॉयल कॉलेज ऑफ फिजिशियन कहते हैं, दूसरे ब्रिटिश सोसाइटी कहती है कि 15 तक होती है। अब या E ऑप्शन है या A है।
नॉन इन्वेसिव वेंटिलेशन NIV।
मेरे को सेटिंग कौन सी इसके लिए सबसे अच्छी होगी?
मेरे कहने पे A लगाने। Inspiration
20 seconds left. It's nail biting.
Option A.
Dr. Kirwan, I am here.
Welcome, Professor 𝐒𝐓𝐄𝐄 Saab. Welcome.
Initially, I had some problem with the connection.
Can we have an answer?
Solved now.
What's the answer?
A for alpha.
A for alpha. Lock it in, lock it in, lock it in. Yes, they've done it again. 5 in a row. That's brilliant momentum and brilliant teamwork by Saiwal Stellars. I'm sorry, Professor Saab, we had to interrupt. They had to give their answer. They had 2 seconds left. Professor 𝐒𝐓𝐄 Saab, are you there?
Yes, I'm here.
Welcome, sir. Sorry we had to interrupt your introduction. They had 2 seconds left and they got the answer right. They had the correct settings for non-invasive ventilation. Saiwal are doing very, very well.
Sorry, I missed the initial bit because of the connectivity problem, but I'm enjoying it now.
Welcome on board, sir. We will carry on with the questions. Saiwal, you're doing brilliantly well. You've scored 5 on the trot. Let's move on to the next part.
Question number 9 is, which of the following is most important determinant of mortality in hypercapnic respiratory failure? Option A is pH less than 7.25. Option B is high partial pressure of carbon dioxide. Option C is elevated lactate levels. Option D is prolonged use of NIV. And option E is white blood cell count of more than 15,000.
The clock has started. So, Saiwal Stellars, you've got 5 options. Use the time available. Consult every member.
Yeah.
30 seconds.
The evidence shows that
very gut feeling
for 28 days after being COVID positive, it seems to be off the positivity.
We've got 12 seconds, Saiwal. I need an answer. Saiwal? Unmute Saiwal. What's your answer? Saiwal, I can't hear you. We've got a technical issue. Saiwal was screaming. Saiwal, can you unmute your mic, please?
No, we have beaten.
Saiwal, can you hear me? Saival
Yes,
Stellers.
B for beta.
Okay.
B for beta.
I think we'll give them that because I think there was a mic issue. So I think we should lock it in. If the umpires have an issue with it, we can bring it up later on. But let's go for B for beta. Oh no. Oh no. So it was pH that really mattered. So you went for broke, you needed a high score, you pulled a delivery that you shouldn't have pulled and it skied into the air and it was caught by the wicketkeeper with his massive gloves. You are out. You are out, but not out of the game. You've got one question left. You're still in this. Keep fighting. Last question.
Question number 10 is which one of the following is an absolute contraindication to NIV? Options are: option A is severe dyspnea, option B pH of less than 7.30, option C is hemodynamic instability, option D is partial pressure of carbon dioxide more than 70 millimeter of mercury, and option E is moderate metabolic acidosis.
Let's start the clock. Saiwal, please keep your mics on at all times.
Metabolic acidosis. Contraindication.
Absolute contraindication to non-invasive ventilation. Half your time is gone, Saiwal.
Contraindication मेरे ख्याल से absolute contraindication of NIV, severe dyspnea, pH less than 7.3, hemodynamic instability, PCO2 is greater than 70.
13 seconds. I'm going to need an answer soon. 10 seconds.
Metabolic. क्या करें जल्दी बताओ.
5 seconds.
हाँ?
E for epsilon. E for epsilon. The fifth option, moderate metabolic acidosis. I think I heard you say that. That's right, isn't it? Now comes the moment of truth. The moment of truth, and no! No, no, no! You went for it. It's like you were facing Glenn McGrath. You were fishing outside the off stump and you were caught at first slip. Another one bites the dust. So, that was a very, very committed and brave performance by Saiwal Stellers. They did quite well in places, not quite so well in others. They challenged the initial question and they were absolutely vindicated. They gave a correct answer on the first question. 7 out of 10 were correct, so their final score is 42. There was a good run of 5 questions there where they were unstoppable. But at the end, they lost out. They could have gotten a more competitive score. So MMC Wolves will come up next. But before, let's get some feedback from DHQ Saiwal Stellers. How do you think you did?
वैसे केस A होता.
Hello, Saiwal. Saiwal, are you there?
Yes.
How do you feel about your performance today? You challenged one of the incorrect decisions and you got that right. But how do you feel you did overall?
Yeah, it was disappointed in the end, but in the start we are going fine. We are hitting sixes everywhere, but at the end we got out in 1 or 2 questions. So we are very much disappointed. But let's hope we can still win from here.
Well, I think everyone who takes part in this competition is a credit to their institution. I don't think you should feel so downhearted because it's all about gaining knowledge. And speaking of knowledge, I would like to introduce Professor 𝐒𝐓𝐄𝐄, our patron-in-chief.
Thank you very much, Qurban. I missed the earlier part because of that problem. But I think Saiwal has played well so far. The questions were quite good, and I think I missed the earlier part, so I can't make any valid comments on that. But I think, as you say, it's a learning experience for everybody. This is not a game of losers and winners. This is a game where we just stimulate our youngsters to study and get updated with the new guidelines and new recommendations in practice. So I think nobody should lose heart because he has lost the game. It provides us a platform to learn. And as far as I'm concerned, I always learn something in these meetings. And I am sure my colleagues, distinguished colleagues, will have the same feeling. So I think overall, and this is an academic exercise for everybody, and we should take it from that spirit. And thank you very much for your excellent moderation.
Thank you, Professor
and
Saab, as
maintaining
always.
the order and making it very lively than boring. Thank you.
Thank you. Thank you so much for your kind comments, sir. As always, a lot of wisdom there, a lot of experience from Professor Saab. Professor 𝐒𝐓𝐄𝐒, our umpire, who was called into action earlier on today, would you like to say something about the performance of Saywal today? Professor 𝐒𝐓𝐄𝐒 Saab.
I actually want to ask them, were the questions clear and relevant and not ambiguous? What is their opinion?
Saywal, can you answer that question, please?
No, we can't hear.
Saywal, Professor 𝐒𝐓𝐄𝐒 was asking that did you feel that the questions were clear enough or relevant enough for you?
Yes, yes.
Yes, questions are good.
Most updated and relevant.
All right. Thank you. I have nothing else to say then.
Thank you very much, sir. And thank you very much for resolving the issue earlier on with the question, the
and
options.
I think we definitely came up with a fair decision. There's no regrets. I think we came up with the right decision.
Thank you very much, sir, as always, for your wonderful input. So let's move on to the next part. Let's move on to this. Oh, Dr. Murad Ali is online. So Dr. Murad Ali is the mentor for the MMC Wolves. Can we have Dr. Murad Ali on, please? Welcome, Dr. Saab.
अपना कोच अपना कोच लेके आएंगे वो तो
Dr. Saab, can you unmute your microphone, please? Dr. Murad Ali Saab. Okay, let's move on. I think we're having a bit of connectivity issues there. But let's move on to the second part. Now, Saywal did very well. There were some complicated and difficult questions there, albeit relevant ones. And let's see what MMC Wolves can do. So Saywal, it's your turn to ask the questions. And MMC Wolves, it's your turn in the hot seat. You're there out in the middle and you are batting. You are answering questions. So you're in the hot seat. Let's get the show on the road. Let's start the innings. Saywal, read out the scenario. Case A. Saywal.
A 56-year-old male with a history of hypertension and type 2 diabetes mellitus presented to the emergency department with decreased urine output for 2 days, nausea and generalized weakness. On examination, his blood pressure is 85 by 50 millimeter mercury, resting heart rate is 97 beats per minute and regular and has dry mucous membranes. Initial investigations shows creat of 3.2, blood urea BUN of 52 and serum sodium 130 milliequivalents and serum potassium 5.5. Urine complete examination shows +1 proteins but normal sediments. Urine osmolarity is 500 milliosmoles per kg.
Okay, MMC Wolves, can you see the scenario on your screen? MMC, are you there?
Yes, sir, we can. Yes, sir, we can clearly see the scenario.
Good. I hope you've processed the scenario as read out to you by your colleagues from Saywal. Saywal, can you please read out question 1 and then we can start?
What is the most likely cause of his patient's acute presentation? Acute tubular necrosis, pre-renal azotemia, post-renal obstruction, chronic kidney disease, glomerulonephritis.
The clock has begun. Saywal, please don't say anything during this because we need to know what the other team is saying. Can we have MMC Wolves on the screen, please? MMC, you've got 39 seconds. Consult amongst yourselves. Don't unmute. Don't mute. Don't mute.
Don't use mobiles.
20 seconds.
Use your IQ.
I can't hear you. 10 seconds.
It's option A, acute tubular necrosis.
Okay. Is that the opinion of all of you? Are you sure?
Yes, sir.
Well, time's up anyway. So let's lock that in. Acute tubular necrosis. Is that the correct answer? Oh no. Oh no. Oh dear. Celebration from Saiwal. That's not very sportsmanlike. That is not a good look, Saiwal. Let's focus on Mardan. Mardan. Can we have Mardan on the screen, and can we mute everybody else, please? Saiwal, can you hear me?
Yes.
Saiwal, I'm going to ask you. We can't have anyone reacting to other people's correct or incorrect answers, and we can't have people talking when we're trying to get feedback from the team that's answering questions. So please, I would ask you to refrain from any comments or any feedback on the performance of the team, particularly during the competition. So we won't have any of that, please. So the answer was pre-renal azotemia. Unfortunately for Mardan Medical Complex Wolves, they got the first question wrong, so they were out. But let's see if they can turn it around. They've got 9 questions, and they need to score as high as possible to give them the best chance of winning this game. Let's carry on. Question number 2. Saiwal, please read out the question.
Which of the following findings is most consistent with pre-renal as a AKI? Urinary sodium greater than 40 milliequivalents, muddy brown cast in urine sediments, fractional excretion of sodium, urine osmolarity greater than 300 milliequivalents, proteinuria greater than 3.5 gram per day.
Okay, can we just clarify the options? I will read out again because I think one of the sections was missed. Option A, urine sodium greater than 40 milliequivalents per liter. Option B, muddy brown casts in urine sediment. Option C, fractional excretion of sodium or FeNA less than 1%. Option D, urine osmolality less than 300 milliosmoles per kilogram. And option E, proteinuria greater than 3.5 grams per day. Now, start the clock.
Can I use washroom?
It's option number C, sir.
Option C, we've got one opinion. Is that the opinion of all of you? Fractional excretion of sodium less than 1%? Is that what all of you think?
Yes, sir.
Okay, Captain, it's your call. Let's go for it. Let's lock it in. C. Yes, that was brilliant. The captain leading from the front and ably supported by his team members. So you had a disappointment on the first delivery. You were knocked down, but now you have arisen and you have hit the next ball out of the park for 6 runs. So well done. Very brave of you, Mardan. Not an easy question at all. Let's move on. Question 3. Saiwal.
Which of the following is the most appropriate initial management for this patient? Furosemide infusion, intravenous normosaline, emergent hemodialysis, sodium bicarbonate infusion, high-dose corticosteroids.
Those are your options. A, B, C, D, E. The clock has begun. Mardan?
B. Option number B. Intravenous normal saline.
Okay, so you've gone for option B. Is that the opinion of all of you or just some of you?
All of us.
Okay, all 4 of you. Okay, let's not delay. It's decisive. Option B, lock it in. Yes, you've done it. You've gone down the track to the spinner And you have smashed it to the leg side. Slog for 6. So very aggressive play, very decisive, and well done. You've started your momentum. You've got a score of 12. That's brilliant. You're on the right track. So let's move on to question 4, please. Saiwal, read it out.
Which laboratory finding is most suggestive of intrinsic renal failure, ATN? Urine specific gravity greater than 1.020, urine sediments with muddy brown cast, urine sodium greater than 20, serum blood urea nitrogen divided by creatinine ratio greater than 20:1, urine osmolarity greater than 500 milliequivalents.
Okay, before you start the clock, I'll need to stop the clock. I will need to read it out because there was a mistake in reading the options. Let me read out the options again. So the question is, which laboratory finding is most suggestive of intrinsic renal failure, e.g. ATN? Question mark. Option A, urine specific gravity greater than 1.02. Option B, urinary sediment with muddy brown casts. Option C, urinary sodium less than 20 milliequivalents per litre. D, serum BUN/creatinine ratio greater than 20:1. Or E, urine osmolality greater than 500 milliosmoles per kilogram. So I had to correct that. Start the clock.
It's option number B, sir. Urinary sediment with muddy brown casts.
Okay, that's what you think the answer is. Is that the opinion of all of you, Mardan?
Yes, sir.
Rather quick answer, you see. Very quick.
So we always, Professor Saab has noted that you're answering very quickly. Professor Saab always advises our teams to think about it, but since they've committed to the answer and they're sure of it, let's lock that in. The answer is B, I believe. And they're correct. They're correct. They are certain of themselves, they're confident in their knowledge, and they have scored very well on this question. And it's not an easy question. I think Professor Saab,
very well done.
From my own medical training, I always found acute tubular necrosis very, very complicated and difficult to deal with, knowledge-wise. And I think the team has shown that they have good knowledge in this area.
I must say, well done, Mardan.
Thank you, sir. Thank you so much.
Great job, Mardan. Excellent. So let's move on. Next question, please. Question number 5. Saiwal Stellers, please read out the question.
Which of the following drugs is most commonly associated with the acute interstitial nephritis? Amlodipine, ibuprofen, metformin, ranitidine, warfarin.
The clock has started.
Option B, sir. Ibuprofen.
Okay, the captain has spoken. He's leading from the front, but is that the opinion of all of you? Because you've got time, you can change your answer if you want.
It's confirmed, sir.
All right.
Ibuprofen.
You have spoken, so let's lock in option B for brother. They've done it. They've done it. So the non-steroidal anti-inflammatory drug ibuprofen is commonly associated with acute interstitial nephritis. MMC have got that correct. They're building up momentum now. They really are building up momentum. 3 in a row. Sorry, 4 in a row. 4 in a row. 24 points. So just like Saiwal had a period where they were dominating, MMC is dominating this match right now, but they're still away behind the Saiwal Stellers, who have a score of 42. And MMC Wolves currently have a score of 24, but they have 5 more questions. MMC, let's move on to question number 6. Saiwal, please read out question 6.
Which of the following electrolyte disturbance is most commonly seen in acute kidney injury? Hypokalemia, hypophosphatemia, hyperkalemia, hypercalcemia, hypomagnesemia.
Okay, straightforward options. 60 seconds. MMC, what do you have?
It's option C, sir. Hyperkalemia.
Answer. Is that the opinion of all of you?
Yes, sir.
Okay, you're all nodding your head. I've got no choice. Let's lock it in. Option C, hyperkalemia. Again, devastating blow. A slog down the track, smashing the fast bowler on the offside for another 6, crossing the boundary, clearing the diving fielder. So devastating blow by MMC Wolves. They're not far behind now. They've got 4 questions left and they're still 12 points behind, but they are in position, pole position. MMC Wolves, get yourself ready. Question number 7. Saiwal, read it out, please.
A post-renal cause of acute kidney injury is most likely in which of the following scenarios? Patient with nephrotic syndrome, patient with severe dehydration, patient with retroperitoneal fibrosis, patient on aminoglycoside therapy, patient with systemic lupus erythematosus.
Start the clock. Can we have MMC on the screen, please? So I can hear whispers for retroperitoneal fibrosis. 30 seconds left. 30 seconds left, Mardan.
C, sir.
Is that the opinion of all of you? Take your time. You've got time. Is that your final answer?
Yes, sir.
That is the final answer.
Yes, sir.
Option C for patient with retroperitoneal fibrosis. Lock it in. Yes. Again, brilliant play. Brilliant by MMC. They're closing in on that total. They really are. They've got a score of 36. They're just one mighty blow away from equaling the Saiwal Stellars total. So Saiwal is feeling the pressure a little bit. I can see that. Some of the team are really feeling the heat. But that's okay. Everyone's a winner in this competition. Everyone's learning and learning together. So, MMC Wolves, ready for question 8. Read it out, please, Saiwal.
The most definitive diagnostic test for a suspected obstructed uropathy is urine analysis, serum creatinine, renal ultrasound, cystoscopy, voiding cystourethrogram.
Start the clock. Read the stem, read the question, read the options, and take your time.
Yeah, for some mass with stones we can aga upagigori. Renal ultrasound, say. It's option number C, sir. Renal ultrasound.
You've got time. You can
Renal
change your
ultrasound.
mind. You're absolutely sure. Nobody's dissenting there. I can't hear anyone saying anything else. So we'll have to lock that in.
Yes, sir.
C, renal ultrasound. Are they correct? Are they correct? They are correct. They are correct. So once again, another cover drive over the boundary for 6 runs. Devastating blow because now they have equal the score of Saiwal Stellars. They've got 2 questions. I would like to welcome my wonderful senior colleague, Dr. Lubna Mehraj, to the podcast. Welcome on board, ma'am. Great to have you. Okay, we'll get back to that. We're in a very exciting contest right now. Saiwal Stellars set a competitive total of 42, and their score has been equaled by MMC Wolves. Despite an early setback on the first question, they have had a sequence of 7 correct answers in a row. So well done to MMC Wolves. Great performance, and you can do even better now. You've got a maximum potential score of 54. So let's see how you can do. Question number 9. Saiwal.
Which of the following is a major indication for urgent dialysis in AKI? Serum creatinine greater than 3, serum potassium greater than 6.5 milliequivalents with ECG changes, urine output less than 0.5 ml per kg per hour for 6 hours, blood urea.
Option number B. Serum potassium of more than 6.5.
Please wait for the answer. Saiwal, carry on. Option D, please. Read it out.
blood urea nitrogen greater than 50 milligram per deciliter, serum bicarbonate greater than 22 milliequivalent per liter.
We will only accept your answer after the question has been read out. So now, MMC, it's in your hands. MMC on screen, please.
Option number B, sir. Serum potassium of more than 6.5 with ECG changes.
Okay, so that's the opinion of one of you. Is that the opinion of all of you?
Yes, sir.
You're all nodding your head. You've tied my hands. I can't do anything now. I have to lock it in. Option B. It's a lock. Brilliant. Brilliant. You've scooped the spinner behind you. It's gone over the wicketkeeper. It's gone over fine leg and it's gone for 6. A classic shot. Brilliant, brilliant play by MMC. You have won this contest definitively. You have got a score of 48. You have overtaken the score of Saiwal, who scored 42, and you have one question left. You can do even better. So let's move on to the final question. Saiwal, please read out the stem.
Which of the following best differentiate pre-renal AKI from intrinsic renal failure? Urine osmolarity, blood urea nitrogen creatinine ratio, presence of red blood cells, serum albumin level, serum potassium level.
That's fine. You've got the options there.
Option number B, sir.
Okay, within 3 seconds, another answer from MMC. They're so confident in their own abilities. MMC, is that the opinion of all of you? B.
Yes, sir. B.
B.
B, bro.
B, correct.
So that's BUN/creatinine ratio. Is that your final answer? Can I lock it in?
Yes, sir.
All right, that's fine. Lock it in. And again, absolutely dominating the bowling. Smashing a square cut
Questions are very much easy.
over the offside boundary for 6 runs, and that is it. You have won this competition, this contest in particular. So you've got a score of 54. Brilliant performance by MMC Wolves. MMC Wolves, is there anything you'd like to say?
Thank you so much, sir, for this wonderful opportunity. It was really interesting. And I would like to say best wishes to my other colleagues who also perform really well. And thank you so much from our side.
Great sportsmanship, MMC. You almost had a perfect score. You just missed out on the first question. That was very, very unlucky, but that's the way the game goes. A score of 54 is an excellent score. You're a credit to your institution. Saiwal, Stellas, I'd like your feedback on this competition as well, on how you did. Saiwal, are you there?
Thanks for inviting us, giving us an opportunity to play the game, to learn about different cases and questions. An interactive session is always good. Unfortunately, we chose the wrong case. It was a bit difficult because in the general medicine case, we always deal with these nephrology patients, but these pulmonology patients and these ventilator settings, they do not come into account every day. So, but it was good. The other team was played very well, and they answered all the questions. And it was good to have you, and it was good to learn things about both pulmonology and nephrology cases. Thanks to all the team.
Thank you. We have Dr. Murad Ali, who is a coach of Mardan. Can we have Dr. Murad Ali on board, please?
Yes. Thank you so much. Assalamu alaikum to all. And it was a really nice contest.
Coach.
As earlier mentioned by Professor Aziz, no one is a winner in this contest. This is all just, we are learning from each other. And I really appreciate such kind of activity because this not only puts the ability, the ability of the students, but also increases their interest in their in sort of cases and academic activities. So I wish all the best to all the teams, and I'm proud of my team Mardan, who really did well, except from the first question. So they were absolutely stunning today. I'm proud of them. And
they really
thank you to
performed well.
Yes.
So
Yes, very well
I'm
performed.
sure you're extremely proud of your team, sir. Thank you very much for joining
Yes,
us.
exactly.
And well done to
Thank you.
everybody
Thank you.
associated with MMC. Well done to Saiwal as well. We'd like some feedback from Professor 𝐒𝐓𝐄𝐋𝐈.
Thank you very much. What an exciting match. What an interesting match. I mean, the biggest thing that came out is that these small towns, relatively smaller cities, are fighting such a good tournament, taking part. And in the same tournament, we have got teams from Lahore, Karachi, Peshawar, old centers, senior departments, and these relatively new departments from Mardan and Sahiwal coming up with such nice performance. It's really very, very encouraging, and I'm really very, very impressed with the way both the teams have played, and they've shown sportsman spirit as well in their comments. Mardan has done excellent. And by the way, I have fond memories of Mardan. I studied there for 2 years in the government college, which is now
Great.
Abdul Wali Khan University. So it gives me some pleasure as well from my old alma mater. The youngsters coming up so nicely. I think Wilson must be complimented for this effort because this is a unique way of learning and providing a stimulus to our youngsters to read more and more and come up with, and it's improving their presentation skills and their confidence. So I think this is a package which really academic, social, everything. So hats off to the organizers, and I must give my gratitude and credit to Professor Aziz Rahman for formulating such nice and practical questions with clinical application. So I think in all fairness, this is a wonderful exercise that we have every week. We learn a lot. We meet our friends. We meet our colleagues, and we hear your sweet voice and your comments. And I'm sure Pakistan Cricket Board will be looking for you for commentary in one of its matches. You see the way you are conducting it. तो मेरा ख्याल है
Very
मोहसिन
exciting.
नकवी साहब को आपका पता नहीं चला. अगर मोहसिन नकवी को आपका पता चल जाए तो you won't be sitting here, my friend. So thank you very much to everybody. And before I lose my connection, I would take leave.
Thank you so much, sir, as always, for your wonderful insights. Thank you. Professor Azizur Rahman Saab.
Thank you very much. I think I have number one, I have to reply to the comment made by Sahiwal. They said they chose the more difficult question. I think because just random choice, I try my best that in a given match, I keep both the questions of equal difficulty and from the similar type. For example, this time it was acute respiratory failure versus acute kidney failure. And there is no way on earth to make two questions exactly of the same difficulty index. And it also depends on their experience and their knowledge. So it's just that luck. I think the questions are fair. Now, the second team, I think they probably did not read the scenario. I don't understand how could they miss the first question, which was so easy, and they did not read the scenario. Scenario clearly showed that this guy was not eating or drinking well, was not putting out good urine, and blood pressure was low. So it was a clear-cut case of pre-renal azotemia on the top of chronic kidney disease. I think they probably need to concentrate on the scenario more. I think when you start the game, you should arrange it the way that the scenario should stay in the screen for such slightly longer time. It will be best if it stays throughout the match. I think that is, if it is possible, or at least before you ask the first question. This is for our commentator. That before you ask the first question, I think give some more time, maybe 30 more seconds. You do ask if they have absorbed the question, but I think some more time should be given. Thank you.
Thank you very much for your insights, sir. Definitely something I think we should do. But a wonderful performance today by MMC Wolves and a creditable performance by Saiwal Stellars. I think they were both a credit to their institution. So, where are we now? We are at the second match of Group C, which is concluded. There is one match left in this group, and there are 3 groups left. Groups D, Groups E, and Groups F, after the final match in Group C. So there's still plenty of teams yet to come on board into the competition. We've seen the depth and breadth of talent in Pakistan amongst our young doctors, and I'm sure we're going to see a very, very healthy competition going further forward into this competition. So, with that, let's conclude this session. This session was brought to you by Wilson's Pharmaceuticals in association with the Pakistan Society of Internal Medicine and Pakistan Hypertension League. We will see you next time. From me, Allah Hafiz.